Good evening. This is Eric Nelson with AARP South Dakota. Thanks again for joining us for our third AARP on tap, done virtually this year because of 2020 and the COVID pandemic that we're dealing with. Appreciate you being with us again. As I said, this is our third one. Then tonight we're focusing on state government. Our special guest with us this evening is State Senator Deb Soholt. If you've been with us in the past, you know, I've mentioned that we typically do these in person, but now we're doing them virtually this year, which has kind of given us a fun opportunity to bring in special guests, and we're pleased to have Senator Soholt with us this year. If you've been with us the first two times, you know what I'm about to say. Thank you for registering. By registering, you were eligible to receive, while supplies last, some drink mix packets and a corkscrew and a bottle opener to kind of go with our on tap theme. We wanted to try and make it as fun as we could, and this was a great way to do that, to hopefully have a drink while you're learning some stuff here as we round the corner for election year 2020. Also, if you attend all four sessions and take a questionnaire at the end of the fourth session, you'll be eligible for our sweepstakes. Our sweepstakes includes is $145 worth, and it includes a cocktail shaker and a wet bar mat, along with a $100 Visa gift card. So if you come to all four sessions and you registered, please fill out the questionnaire at the end and register for our sweepstakes, which the drawing will be held on October 29th at 9 in the morning, and you'll be contacted if you are the winner. Also, we have one on tap left, and that will be held next Wednesday at the same time, 6:30 Central, 5:30 Mountain. We'll be joined by Rapid City Mayor Steve Allender and Sioux Falls Mayor Paul Tenhaken to discuss livable communities. And so we're excited to finish up our on tap series with those special guests next week. As I've said in the past, as we're having our conversation with Senator Soholt tonight, please feel free to offer a comment or a question in the chat box, and we'll make every effort we can to get to your questions and get to your chat comments as time allows here this evening. We'll try not to go past 45 minutes, and because it's especially important tonight, because at 8 o'clock on South Dakota Public Broadcasting is the U.S. Senate Candidate Forum with Senator Mike Rounds and former state legislator Dan Eilers, who is the Democrat challenging the Republican this year in our U.S. Senate race. So with that, I would like to bring in our first special guest of the evening, Jackie Sly. Jackie Sly is a retired teacher, and after retirement, she served 8 years in the South Dakota House of Representatives. She's currently on the South Dakota Board of Education Standards and the South Dakota Indian Education Advisory Council. She is active with the state and local retired school personnel organizations, and her commitment continues with making the world around her a better place by serving on several nonprofit boards. AARP South Dakota is grateful for her volunteer leadership in community events and in sharing fraud fighting and livability presentations to groups around the state. She is married and has 3 grown children and 4 granddaughters, and is very close to Senator Soholt. But as 2020 has taught us, we may be having some internet issues with Jackie Sly tonight. So she's been on and off with us at different times this evening, and I don't think we have her with us right now, which is kind of how 2020 has gone, unfortunately. So if we get her back at some point during this conversation, we'll bring her in, because I had a couple questions for both she and Senator Soholt. But without further ado, I'll bring Senator Soholt on. Senator Soholt has been in the South Dakota legislature for 8 years and is a nurse by trade. Is that correct, Senator Soholt?
Yes, that's right.
Went to South Dakota State University and resides in Sioux Falls and is retired. Is that correct? Or
sort of.
Retired from nursing and soon to be retired from the Senate after her four 2-year terms are up. So I know for some of you, you've seen her with us before at different events, and we're excited as she wraps up her Senate career here this year to have her with us one last time as a sitting state senator. And Deb Soholt, thank you for being with us tonight. Appreciate you having you. Please feel free to offer any comments and any additional background that I may have missed.
Well, hello, everyone. And, in honor of all of you, even though we can't do on tap, I did, just in the spirit of AARP on tap, and really appreciate having this time with you. The last time I was with you, we were actually in session and people had traveled to Pierre, and we had at that visitors center, we had a great conversation, and I always enjoy spending time with you because you have such rich questions. And right now I sit not only in the Senate, and as Eric mentioned, I'm terming out of the Senate, but I'm also chair of the Senate Health and Human Services Committee. So with this COVID pandemic, have been incredibly busy, both through veto day, moving into special session, things that were happening this summer, and have always been very active in health policy. But not only that, I'm active in issues of just vibrancy overall for our communities, because health is so much more than just, do you have a disease or don't you have a disease? Health is about how you live your life, and do you have enough support structures around you, and how are your finances, and what are you doing in extended family care? There's a lot of that happening right now, and issues that I think we're going to discuss tonight with the elderly. And as Eric said, I did button up a 40-year full-time career as a registered nurse and was working as the director of women's health for Avera. It's a fantastic career to be a registered nurse. And with Dr. Melody Shop, who I got to know through a project that Representative Jackie Sly and I worked on with, which is education funding reform, we have linked arms and started a company to accelerate the influence of women. So it's called Influential She. So it's been really fascinating to become an entrepreneur after the end of a long, what I call being an institutionalized career. So it's bittersweet to be moving on from the Senate.
Well, we're definitely going to miss you, and you've accomplished so much in the time that you've been with us in the state Senate, and we know we won't. We'll keep hearing from you even after this year's election. And thanks again for joining us this evening. You mentioned being with us at our lobby day back at the end of January, and in some ways that wasn't that long ago, and other ways it seems like it's been so long ago. But that was obviously kind of before COVID, before it started to impact our lives and impact the country. And so we were lucky enough to get the main run of our legislative session done in January and February and into early March. And so let's just kind of start there and make our way throughout the year if we could. And why don't you give a summary of some of the important issues that you championed in 2020? And I know a lot of the issues that you have always worked on impacted our members, and including the ones that you were focused on this year. So talk about how your 2020 session and some of your accomplishments, please.
It's almost just surreal to think about the difference that happened from right at the very end, the last week of formal session before we got into voting on the G bill, is when we had our first real briefing on what was happening with the coronavirus. I mean, so think about that and how transformative this time has been, all the way to veto day, ending up being a virtual veto day, which was just 2 weeks later. So it's amazing how quickly the world can tip on its head. This past year, during my time in the Senate, I actually chaired 7 interim groups in 8 years, which was busy and exciting and extremely interesting. And in the last couple of years, I have been providing leadership around the mental health issues within our state, particularly around access. And the first year, we just tried to wrap our arms around the whole scope of what was going on. In the second year, we really got serious through 5 separate interim work groups on what we could do in mental health access. And so this past session, we had some hallmark pieces of legislation that have made all the difference now during this pandemic, of establishing the runway of how we can provide access virtually in particular. 2 hallmark pieces of legislation, I think, that really apply. We did a lot of things in liability, but there were actually probably 3 pieces. One was the establishment of what it means to have a regional mental health center, so that we are able to create this sweet spot, if you will, for someone that doesn't need to go to a hospital, they don't need to go to jail, but they really can't stay home. They have to be restabilized. And so what we have done is created the structure, the infrastructure statutorily, so that these regional situations can emerge. The second piece that we did was all of the work in virtual mental health, which I just think is quite interesting now that we've gone virtual in so many different ways. And I'd love to hear what you think about that. as an AARP population. But what we did is we created that we could do crisis mental health or just crisis intervention of any kind in a virtual way. And what did that mean and what kind of criteria had to be there? Because previously in telehealth, you had to have a patient-provider relationship, you had to have an established medical record, you had to do informed consent. And when you think about an ambulance coming to your home for a heart attack, if you would have a mental health issue, it would be the same kind of consideration that it's a crisis and someone's coming into your home virtually, and that can be a qualified mental health professional that can come in. And we know that if a QMHP, they're called, can come into the situation in the time of crisis, that 90% never have to leave their home. And then there can be follow-up with those individuals within 24 hours, and we can link them back to community-based services. So we're very excited that we got that in place. The next piece that was really critical, we actually had 8 bills that came out and an additional resolution that came out of our work last summer. One was to fully fund throughout the state the 211 line. Now that is becoming huge in relationship to the pandemic, that people would have an access not only for healthcare issues or who are their community-based services that are on the ground, but for things like tornadoes and floods and pandemics and all kinds of things, that 211 can have a database that really helps to understand what is available in this locality and how can we link you to that. So we're really proud of that legislation. We got halfway there the year before with 50% funding and 50% by the counties. This past year, we were able to get that fully funded. And additionally, they're doing another mental health access continuation task force, the only task force that was funded this past summer, in order to continue moving forward on this establishment of a new infrastructure for mental health support. 211 also provides something really significant in relationship to suicide prevention. They are linked with a national suicide hotline. So for numbers that come in and people that are in distress, they have talent to be able to de-escalate that situation in the moment. So we think that's really important to the overall health access and getting people linked up to what's available to them. So the more that you can stay home by the development of these regionally based mental health centers, we think is really important. And we're seeing that with COVID, the development of what can you do close to home? What do you need to transfer to a larger metro center for? We're getting better and better at COVID treatments. So what happened then on veto day was just really unprecedented because we were virtual, which is unheard of. We started at 9:30 in the morning on a Monday and we got done at like 4 a.m. the next day. And we dealt with 14 bills, which normally on veto day, you're just dealing with 1 or 2 bills that the governor has vetoed, and we're talking about things that we've already discussed before. So this was a historic way to function in government.
Yeah, no, absolutely. And you touched on a number of things that were important to us. And thank you for your work on the mental health task force. I know you've put in a lot of time over the last couple of summers and legislative sessions working on those issues. We were very involved with trying to support your efforts to address the 211 helpline, making that a statewide program each of the last 2 sessions. And congratulations on successfully getting that done here in the 2020 session. It's a very important program for seniors in South Dakota, and it's been utilized very well by seniors in Sioux Falls and other areas that have had it for quite some time. And now we're pleased to see it being offered across the state. And then you mentioned,
Eric, I want to say something about that because to your members who are listening tonight, I just want to say that, Eric was just completely linked in support for that effort and helping to provide testimony and helping us get that through the finish line. None of these things happen in isolation. It takes a community of people coming together and someone representing your members to say how important that this would be. And Eric knows that these things are touch and go through the appropriations process to determine if, you're going to make it, and trying to work with members behind the scenes and, getting people to understand, even in the most rural areas, a lot of pushback. And, this 2-year effort, AARP was with us every step of the way. So I just want to thank you as well, Eric, for your leadership. And your members should know how hard you're working on their behalf.
Well, thank you. It's an important program, and we were glad to support it. And like I said, glad it's across the finish line now. And then you talked a little bit about telehealth. I know there's been some telehealth legislation in previous sessions, and now the mental health aspect of it. And we've seen, and you being with Avera's been involved with telehealth really since its infancy, going on 30 years ago now. But I think since COVID has hit, we've really seen it, become much more mainstream in healthcare and utilized, and I know, including with our members, and we've tried to put out education efforts for that. Just technology in general, I would, I think if I did a show of hands, everyone would say they're so much better versed with Zoom and technology now than they were 6 months ago, of course, and that could include utilizing telehealth, particularly in our rural areas. And I'm just curious, where do you think our telehealth status is in the state as far as legislatively and the offerings that we have? Is it where it should be? Can it be better? Just comment on that briefly, given your background both in healthcare and in the legislature.
Yeah, and it's a really great question. And I think that's something that AARP members can really start to wrap their arms around and help us continue to move this forward. I think statutorily, we're in a really good place. We put a lot in place on, immunity and privacy and, how the link networks. But what's interesting is where we can go from here. You've seen during COVID, the amount of appointments that can be virtual. And I think about people with chronic health issues, people in AARP, myself, people getting older. We have seen a transformative thing just happen. So we've had telehealth for a long time. I ran a clinic at Avera. We'd done telehealth for 15 years within the clinic, and the appointment was no different than if you were in person or if you were online. We had to figure out the payment mechanism to make it happen. And the legislature has done equal payment parity legislation in the previous year. So there's just a lot of things that are really in place for telehealth. I think what needs to be pushed moving forward is I think there's so many people in their minds in the healthcare system think we're going to go right back to how we used to be. And I don't think we need to. I think that there are conveniences and the ability to link. Before, we've never been really able to connect the healthcare system with the individual person. And that is the next frontier that has to be conquered. Right up till now, we're doing telehealth within, hospital to other hospital or clinic to a patient that's in a clinic on the other end. But we're finally moving into that frontier of clinic to person. And I think that that's a transformation that we have to continue to push right now. And there may be some statutory changes that have to happen to make that work. But with all of us having cell phones in our hands, there's absolutely no reason. And I'm telling you, the biometrics exist now that we need to push for, that you can hook up to your phone so they can listen to your heart rate. They can listen to your lung sounds. You can do deep breathing. There's disposable things to hook into your phone so they can look in your ear and up your nose and in your mouth, all those things, and say, okay, check your own, lymph nodes and see how they're feeling to you. So there are ways to get information to healthcare providers. And already we have that in, walk-in clinics that are virtual. Well, we're just going to see that expand. And I think that's something AARP should continue to push for. There's no reason to put the genie back in the bottle. These are conveniences that can really help with chronic management. And we're also going to see some really cool apps and platforms that help to remind people, that are, we've seen great strides, like in someone that's dealing with mental health issues. If they're just getting support messages every day, the data looks really great in that you can actually have lower medication with you have the right kind of support. So I think the sky is the limit, and AARP needs to help push that platform because it's cost effective and it's good for our citizens.
Absolutely. No, well said, and very important issues, and it's good technology to have right now, that's for sure. After we got through the session, you touched briefly on veto day and briefly sum up, some of those important COVID related bills that were passed in the longest veto day maybe ever, probably definitely for sure in your 8 years being in Pierre, and just kind of talk about the significance of some of those COVID related bills that kind of helped us get through the spring and into the summer here.
Well, I think just in a nutshell, even though we had 14 different issues that we were looking at, the basic summary of all of it was who has what power to do what. And so we were giving authority to the Department of Health, the authority within the governor's office, and then the authority at the local level to decide who's going to do what in relationship to the pandemic. Now, certainly the governor would always have authority to do mandatory masking, for instance. That's not the path we've taken in South Dakota. So I would say a fair amount of veto day was looking at some of that local units, governments, cities. They were asking for somewhat immunity for decisions that they were making in relationship to what might have happened with their business structures. And ultimately, we were not successful in providing that kind of immunity. But what we did do is clarify that the local level has every right to decide. So for instance, in Sioux Falls, they were trying to decide, are we going to do some business closures, non-essential business closures, and then mandatory masking? And when that was being looked at the city council level, then those powers were clarified through that veto day. So it really was about establishing the proper authorities to get us through 2020, when we knew that federal dollars were going to be coming into the state in relationship to COVID mitigation.
Sure. No, yes, thank you. And beyond that, there was, obviously the opportunity for local municipal elections to push those to primary day, and having some flexibility with our primary, which was very important at the time. And as an organization, we've stressed, absentee voting as safely as possible. And I know that our Secretary of State sent out the applications in the spring, and I just read right tonight that over 100,000 absentee ballots have already been returned for the 2020.
It's extraordinary, isn't it great?
Election. Yeah, it's great, and that number is going to go up, and that number already surpassed the number of absentee ballots that were cast in the 2016 general election. So very important stuff. Thank you very much. And then COVID really started to put its grips on our state and the country throughout the spring and summer. And you're a sitting South Dakota senator, and you have a constituent block. What were you hearing from your constituents throughout the summer, COVID related, that was important to you, that struck a tone with you?
Well, there were many issues being brought up. I think a lot of them were handled by some of the federal legislation that happened and how quickly we implemented the programming, such as the payroll protection plan. That really made a difference for small businesses, that they didn't have to furlough their staff, but they were able to keep them on board. So when we were unsure about that, I was hearing a lot of feedback about how we're going to manage payroll. Then, of course, there ended up being the small business hit, and a lot in healthcare. We were spending a lot of time talking about healthcare, and the fact that with all of those elective surgeries that were changed, people were furloughed within the healthcare system, which is just so hard to believe in a pandemic, because of the cash proposition, those that lift up the disease and then empty beds and too much staffing. So I doubt we will ever go back to that place and space where we just, shut down hospitals, waiting for this pandemic. And that was based on the best predictors that we could think of. So I was hearing a lot from healthcare, and we were doing a lot of talking until the CARES Act dollars started coming in and helping to support them and lift them up. Then the next phase of really hearing from people, there was two things that have really started to emerge about mid-July. One was what's going to happen with these COVID relief dollars and the $1.25 billion that came into the state of South Dakota. Where are we going to sort and put that money? Secondly, I started hearing a lot, which I think is important to your members, about the isolation of our elderly, and the fact that, in the beginning of the pandemic, anybody in long-term care or 24-hour assisted kind of living situations of any kind, even if you're level 1 assisted or independent, they were not able to leave their apartments, their facility, and that has continued since the second week of March. So I think in the first 3 months, people were like, all right, we've got to roll up our sleeves. We have to do whatever it is we have to do. We have to protect the elderly. Right. In the next 2 to 3 months, the wheels started to come off that. And there have been big groups, such as there's Advocating for Elderly in Times of COVID Facebook group. I've been working with them a lot on how do we move forward, and with the Department of Health on essential caregivers. Now, that's a really interesting language, but that is about the CDC, the Department of Health, Health and Human Services at the national level and at the state level, saying, really, you cannot just have the elderly locked up, that we have swung so far on keeping them safe from the virus itself. And I mean, face it, what nursing home wants to be the space where 20 to 30 residents end up coming down with COVID? But we've done it at the expense of their decline in mind, body, spirit. And so that group has been looking at these essential caregivers of how do you get, 2 to 4 family members, closest friends, becoming what are called essential caregivers to be able to do visitation for our elderly. We are still struggling with that. And so we started to look at the COVID relief dollars, and, maybe you want to talk a little bit about the listening sessions, Eric. I don't know if we should bring you back in and you can share that structure, and I can talk a little bit about the outcomes in relationship to that.
Yeah, let's do that. Thanks for transitioning to that, because, the legislature did want to hear from their constituents and the groups and organizations that were impacted by the COVID money that the state was going to receive. And I think there was 5 listening sessions, focused on education and agriculture and government. And one of those listening sessions held just last month was on healthcare. And you, as the chair of the Senate Health and Human Services Committee, you held a hearing seeking input on how the coronavirus relief funds that the state has received should be put towards healthcare in South Dakota. And I guess I would ask you, what did you learn from this hearing, and what did the committees recommend ahead of the special session that was just last week?
Yeah, so this was a great process because it was a way for the public to really get their voices out there. And it was an opportunity for me as a chair to really work with people prior to our meeting to say, this is how we're looking at this, and we're going to make recommendations to the Joint Appropriations Committee. Now, I think what's interesting is that the governor has the power to put out the money in relationship to the COVID relief dollars. She doesn't have to we don't have to approve it as a G bill. We have to approve spending authority. But that is something that could be held over to the 21 session. But the legislature felt it was important to listen to the people and really make recommendations in a resolution that would come forward in our special session. So we had a great hearing. It was joint Senate and House Health and Human Services Committee, and my co-chair was Representative Jensen, helped to co-chair that with me. And we came out of that hearing endorsing the governor's $100 million framework in relationship to lost revenue or increased expenses that you can do either in relationship to long-term care and community-based health services. And the original thinking on the governor's framework was that would go through the end of August. Because of the work in the listening sessions, we actually wanted to add another $35 million for long-term care and community-based to get us through the end of the year. Now, that's a tricky proposition, and I understand why from an appropriation standpoint, because you would have to be doing predictive dollars for like October, November, December, because we wouldn't know the real dollars. And it's really difficult from an audit trail to make that work because this $1.25 billion has to be out the door by the end of December. Now, I'll tell you that the governor is working with our congressional delegation, and we'll see if we can get there, that there would be a delay in how we spend that money so that we could do more deep dive in the 21 session. So ultimately what happened is we extended that revenue expense for long-term care and community-based to the end of September and added another 15 million. So 115 million then were recommended to the joint appropriation. Well, we recommended 35 million, but they picked 115 million to get us through September. Another piece that we felt very strongly about and we had very passionate, really concise testimony on was in relationship to this isolation issue. And so we had asked for another 35 million on top of that 100 million for specifically for isolation, to be able to do rapid testing implementation, to get the CLIA certification that people need, to develop an institutional plan, like a physical footprint for the organization so that this long-term care facility, to get them the skill that they needed to mitigate this social isolation that's happening with our elders. Ultimately, the Joint Appropriations Committee did not put that into the resolution, but I will tell you that I am working with the executive branch and I'm feeling very hopeful that there are additional dollars that the governor can spend in relationship to this social isolation issue. And I feel very positive that some things are going to happen over the next couple of weeks, and there's going to be a call out to long-term care in relationship to expertise that they can use to help to get this done, so we can keep people safe but not keep them so isolated. We also recommended that 30 million be allocated to the health systems, the acute care systems, to help them beyond the CARES Act because of the financial difficulty they're in. That ultimately ended up being 15 million that was recommended by the Joint Appropriations Committee. You can understand that they're looking at the input from all 5 groups. We also recommended 15 million for a program that would be for mortgage mitigation and helping people with their rent. And, having an application process. There is a structure called One Sioux Falls Fund that helps people, and it also helps the person that holds the mortgage. So, it doesn't in anybody's benefit if we lose all these people renting and they're evicted, and there was a moratorium on evictions for a while. So from a health committee, we thought this was important, and the resolution did appropriate some money for that. We also heard really impassioned testimony about food distribution and the increase in the utilization of the food distribution, like, any food bank within a community, and Feeding South Dakota Food Bank. And what would that look like to help them? Because the governor had also allocated $400 million for small businesses that had lost revenue. And people can apply, and that application process is just beginning now in October. It's right now in these next 2 weeks.
Right.
And so the hope is once business gets going again, then the philanthropy of business back to the food banks will help. But this is about providing a stopgap. And ultimately, the Joint Committee on Appropriations recommended that be for nonprofits, which would include the food distribution, and they increased the dollar amount. So all of those, and there's more to it, but I don't want to get into more detail tonight, but you can see that on the LRC website, that all of the things that were in the resolution that was brought forward before the House and the Senate on our special session day last week, Monday.
Yeah, briefly talk about how that day played out, as a continuation to what you did just the previous week or two before that.
So because it all happened so fast together, it was really interesting to see the process of the public. You never see this go this fast, but to see the input from the public and then have it translated into a joint Senate and House resolution that is guidance for the governor on how to implement the work of this $1.25 billion. How do we support the state of South Dakota and start to bring ourselves out of this COVID pandemic, even while it's still raging on? And
right.
So it provides guidance to the governor. And, we didn't just do this in isolation. We were working with the executive branch all along the way. And we got a lot of things that came from the listening session. So 2 things happened in special session. One is that we affirmed a bill that actually gave the governor the spending authority for the $1.25 billion. And we didn't have to do that, but it is a process that's really important to say, because the legislature, we're the only people that can appropriate money. And this money was coming from the federal government. There is authority on that pass-through that the governor could elicit that into what areas she feels are important. But backed up in relationship to that so that spending authority was a formal bill. And then additionally, there was a joint House and Senate resolution that underlined how that 1.25 should be spent. And so I would suspect, and we're already seeing evidence that that's being followed by the governor. So it is about a partnership between the legislature and the executive branch to make sure the voices of the people are heard. And we know that everyone won't be satisfied with what happened. There's not enough money for everyone, but it is about fairness and application and objective data that helps to show that you're in need.
Well, and you talk about that 1.25 billion, and in some conversations I've had with our members, and you referenced it, and just to clarify it one more time, this 1.25 billion that was in some of those the federal legislation from this spring, the state, there's been the term spend or allocate. It has to be spent by December 31st, not just allocated by December 31st. Correct. So you speak of the timeliness of it. So things are moving fast because of, we're already into Q4, right? And the special session was held October 5th with a short 3 months until the end of the calendar year. And, thank you for your work on all those important issues that you addressed during the listening session, and that ultimately were the blueprint for the governor to follow or use as a blueprint, throughout the end of the year. That's going to be very important for the healthcare industry and for our members here in South Dakota as we round the corner into the cold weather and cold and flu season, and what will probably be a very, very busy fall and winter in our hospital systems here in the state. That's for sure.
And I just think we're in fatigue. We're in fatigue as people, and we've never lived in a pandemic, and so the interruption to our lives, and then just the long-term kind of tenacity of how this is. People are sick of it, and we're still deep in it, and our numbers are rising in South Dakota. We still have to work really hard to protect ourselves, protect our neighbors. It's once schools got started and once some larger community gathering kinds of things started, we were going to see a spike in the pandemic. And I've been spending a lot of time, I don't know if you've heard the national news tonight, but there's actually 3 vaccine companies that are stepping back a little bit from their trials because they've had some outcomes that were unexpected and unwelcomed. And so they're going to be, so big ones, Lilly, AstraZeneca. And, it doesn't mean that things are held off. I just think the promise of a vaccine, in fact, I had a National Health Innovation Task Force meeting today, and there were 2 physicians on nationally, and they just said the director of the Public Health Association for the entire nation, he just said, it's going to be a year,
Right.
honestly, as a nurse. And we'll have some, very sick people that are going to get vaccines, very vulnerable populations, but it is not going to be like to all of our nursing homes and all of our elderly, maybe by next summer. So these things, we've got a good 6 months of hunkering down, going into the darkness and into the cold. And
Right.
We're going to have to really work together as people to watch out for our neighbors and watch out for those you love, because these could be very dark times for people. And I just want you to know, as AARP members, that we're kind of the community watchdogs on those we love and those around us and the elderly that live on your block. And, this is a time where we can reach out and watch for people, and just know that like simple things like 211, if you're worried about anybody, 211 is a lifeline for you. And that there are people that deeply care that want to get you connected, with someone. And so if there's nothing else, that 211 is going to serve us well over this next year of getting people what they need.
Very well said, and very important. And you're right. We are rounding the corner on the year, and there's 6 months behind us, but we don't know how much is still left in front of us dealing with this pandemic. But it's going to be longer than we hope. That's for sure. And you said we've never been through this before, and come January we'll have our first legislative session, during a pandemic, and you won't be there as your 4th term expires. But if you had to look into a crystal ball, what do you think some of the important issues will be that the legislature will have to address, COVID or non-COVID related here during 2021?
Yeah, well, they're going to be really challenged with this COVID issue. And limited dollars and what has happened to our revenue stream in relationship to trying to balance the budget. So I think about the session, okay, fast and furious anyway. And so there's going to be just trying to keep up with what is normal business that we do during the legislative session, but then on top of that, COVID. And so I really think the pandemic will take the front and center space. I think what's going to be really interesting is, what kind of financial base is there going to be to handle the outcome of the pandemic, the changing revenue stream that's coming from just tax dollars spent, and then also just keeping our people safe and well. So I would suspect that 21 is going to be more about the pandemic, just because of if we get another federal relief package that might happen by the end of the year, it's possible. They're talking about another $1 trillion something package, but it's also possible nothing will happen. And then there's going to be some very deep constraints that are going to start to be experienced starting in November. That the money coming in up till now is really helping to hold everybody whole. But when you get to the daily living of what this new experience is, and we don't have the economic recovery that we've been expecting, especially being in the winter, just what you expect in the Christmas season and shopping. And, thank goodness we did the Marketplace Fairness Act, and that went to the United States Supreme Court. Former Senator Deb Peters really had her footprint all over that in making sure that happened, and that was litigated by our Attorney General, Jack Lee. And we won that case to be able to get some tax revenue from the online business shop. And, some people are doing really well in retail, hardware stores, do it yourself. I mean, everybody's at home and they're fixing stuff and, they're doing projects, but there's others that are not doing well. So we won't know the full extent of that sales and use revenue until, mid-February, somewhere in there, the post-Christmas season. But I just have a feeling people are going to be holding a little tighter this year. Sure. So it will be a very challenging session.
Agreed. Let's switch topics here real briefly. It's early October. We've got 3 weeks, I think, until Election Day. You're not out on the campaign trail this year, and I'm sure that campaign trail looks very different than it has in previous years. But when you did go door to door or speak with constituents when you were running for office, what was some of the best feedback that you received, and how did you like to hear from your constituents? I'm just talking about, we have advocates that we ask to contact you all the time, and what was the best way to get in touch with you, and what was the best feedback you received as far as certain issues or anything like that? Just kind of talk about interaction with constituents and what works best real briefly.
Sure. Well, first of all, it's really weird for me not to be in a campaign. I mean, I have to admit, and this is a time when, you wish there wasn't term limits in a chamber, because if I could run for another couple years in the Senate, I most definitely would have. So it feels unusual, and but good in its own way.
Right.
And what I loved about campaigning, and still do, is just the relationship and the connection with people. We're a citizen legislature, so we represent just ordinary people. We're not in some tier, off by ourselves. And so it was really important to me to always be in touch with, what are people thinking? What are their everyday concerns? What's on their mind? How's it going for their family? What does District 14 feel like? So I was a big canvasser in going door to door. And I love hearing from people with, the virtual connections that we have. But ultimately, more often than not, I would pick up the phone and call somebody back. When I was getting messaging, like from people from AARP, that's important to me. I think as a legislator, probably when you get the same message over and over and over again, you just go, all right, the organizations are leveraging the same message. And so you don't think of it as much as these are individual people, as really an organizational message. I don't mean that in any disparaging way. I'm just saying it's the personalized messages. Like if you would take an AARP message and say, hey, my mom is this, or I'm feeling that, or I'm experiencing this, then I'm hearing the individual voices in all of that messaging. I also loved when people said, hey, can you give me a call? And, we would have a conversation, or even when people were not happy with a decision that I made, to sit down and talk about it, or to talk about it on the phone, to say, I understand that you're unhappy with the outcome. Let me just tell you what I was thinking about when I cast my vote. And more often than not, even if people disagreed with me, they could at least respect that had thought it through on many levels, or I had a perspective that they didn't know.
Sure.
And so, I just think it's that personal connection in South Dakota. That's what I have loved about being in the legislature. Love linking arms, working on things way bigger than myself, with people that really have passion and care, to be in a position to be a catalyst. But you're just really about bringing many, many people to the table to get it done, if you want to do something of great meaning. And so that has been an extraordinary gift for me, to be representing District 14, just such great people. And then it was fun to, go door to door, and, oh, now you have your second baby and your third baby, and you get to know these people down the street. And South Dakota is just small enough that if you want to really know people, and even in our differences, if I see you as a person and you see me as a person, we can usually find some common ground somewhere. It's when we get stuck in our own little dogmatic thinking, my way is the right way, your way can't possibly have anything meaningful to say. That's where we get polarized and really stuck. And it was always my goal to not become a polarizing person, even though I'm sure I was many times.
No, that's a great perspective, and important perspective, especially in this day and age. And as we leave this evening, I have, one last question for you, a real hard hitter here. You're about to transition from Senator Soholt to Deb Soholt again. And what's your January and February and March going to look like, since we won't see you in Pierre, at least here in the next couple of years?
Well, it was going to look like travel. And so, that was, and I'm sure that many of your members were, planning the same thing. I had, a couple of things in mind that was really excited about, but of course, COVID has completely interrupted that. So I'm sure that I will still be watching what's going on in Pierre, but my husband will probably tell you that if I make a few cocktails, that's one thing we'll do. But I would imagine he's going to be working with me on some projects that have gone by the wayside for a long time since I've been in the legislature.
Yeah, well, you've earned it for sure. And again, we thank you for joining us this evening. We thank you for working with us so many times out in Pierre, and championing so many issues that are important to the 50+ population in South Dakota. And as we wrap up here this evening, I'll just remind everyone that we have our 4th and final On Tap event next Wednesday with Sioux Falls Mayor Paul Tenhaken and Rapid City Mayor Steve Allender. And don't forget, tonight at 8 o'clock on South Dakota Public Broadcasting is the Mike Rounds, Dan Allers, U.S. Senate candidate forum. And again, Senator Soholt, I'll call you that officially one more time. It's been great having you with us this evening. You've provided a lot of detailed, important information for our members, and thank you for joining us. That's it.
Thanks, Eric. And to all of you, cheers.
Cheers.
AARP members, and keep up the good work.
Well, that's it for now. We'll see you next week.